morning, everybody. Welcome to the Bill and Kelly early morning show for all of you sleepless people out there. Sleepless in the Bill and Kelly show. Wanted to welcome you, and boy, I tell you, last night, and we're going to get to that in a bit. And by the way, someone made a comment about my hands. No, I didn't get in a fight. A lot of you find that hard to believe, but yeah, I know. No, this is from washing my hands. That's the new norm. Yeah, I'm not a guy that lotions his hands, if you know what I means. I wash my hands, do what I told. Yeah, don't put that lotion on. It's, yeah. And I'm going to start doing that. Boy. How many of you are your hands like this? I mean, yeah, I religiously, anytime I touch a surface, go to the bathroom, whatever, I wash my hands now. In fact, I ran out of soap twice this week. So there you go. One thing I'm going to highlight this show particularly is what we consider the new hero. In fact, they are always been our heroes, and we've just, they're one of these people who are just the unsung hero. They did their job. They stand at the front lines. They take care of us when we're sick. Yeah, and boy, I tell you, it's a lot of times, you talk to some of them, and so the lack of appreciation they have in their own work environment. And that's the nurses. Boy, I tell you, whether you're um, an RN or all the way on up to a nurse practitioner, I guess nurse practitioners, if you talk to people, they do command a little bit more respect because they can do a lot of things that folks can do. I mean, doctors can do. Um, there's my mom from New Zealand chiming in. Robin, good morning, Robin. Yeah, and boy, we're so appreciative of Robin. She's been part. Boy, she's a big fan of ours. We appreciate her. And a friend, become a very dear friend of ours. Yes, use pH. Although Robin, I tell you what, and I'm not sure what it's like there in New Zealand, but here in the States, you can't find hand soap. I know people are making their own hand sanitizer now. A lot of the um distilleries are converting over to making hand sanitizer because they had this, high alcoholic content, which is up there in the 90% or so, and now they're converting over. But I digress. I want to concentrate on the show and what we're going to be calling our new hero. In fact, we had a little bit of thing that we did yesterday. They had mild response, a lot of it because our Facebook settings didn't allow people to post their comments, so I think people just abandon it and move on. We put up a thing about show us your face mask, and we're going to leave that up there, obviously. But what I would like us all to consider is if you know a nurse out there, maybe he or she is your neighbor. If you know someone, if you work with someone, if you were a nurse, we would like pictures of nurses that are out there. If they don't feel comfortable about it, fine. But we're going to create a post today asking for pictures of these heroes, um, and so we're going to call them to light and really put them on a pedestal for a bit, if you will. So what I'd like to do is share with you some pictures here. This one is I showed before, and this really hits home. This is posted in a hospital, and for those of you who may not be able to read it, maybe your screen is so small, they're basically holding up little individual signs, a word each. We stay here for you. Please stay home for us. Boy, I tell you, and I just did which I'll get to in more detail later. Michael Puente, the WBEZ reporter, which is the affiliate for NPR, reached out to me and asked me to collaborate with him on a show last night, update on the COVID-19 virus. And that's something that we strayed away from because we've always felt that you guys get that elsewhere, and we just didn't serve a purpose anymore. I think early on we started doing it because no one else was. I saw the numbers and I look at it statistically all the time, and I said, "Oh my gosh, we're ramping up quickly." And then next thing you know, everyone is reporting them. So I backed away and said, "Yeah, I'll let the people who live on the Indiana Department Health site and post them anytime there is a fraction of a change. I'll let them do that because I don't. We've got a mission here, and that's not necessarily posting those numbers. But I want you to think about these people, and I know we all are. Yeah, and I may be rhetorical here, but please call these people to mind. And I saw some pictures of them that people took, some selfies that they took when they take their face masks off that they're having to reuse because there's not a whole lot of them available. By the way, um, but I want you to celebrate these folks. In fact, I just had some interaction with one of our friends who is a very distinguished war veteran, celebrated war veteran, and even he said, "This is today's new hero." Without a doubt. Our healthcare workers right now are on the front lines. Our first responders, right along with them, they're having to enter situations where they can be infected themselves. Heroes, uh, putting their personal safety aside to take care of people is a hero. So keep that in mind. This guy is my hero as of late. Oh my goodness. For those of you who tuned in last night, this guy not only hit it out of the park, but he hit it in Lake Michigan. There's a ball floating out there somewhere, if you know what I mean. Oh my goodness. Oh my gosh. And we've had some talented musicians on, but this guy has got soul. Oh man, Eli. If you ever listen to the show, you've got new worshipers right now, Eli. Oh my gosh, he came on. He was our concert last night to benefit the Quality Camp Quality USA of Illinois. It's a cancer camp for poor kiddos that suffered cancer, and they take them out and get them to forget about. And so boy oh boy oh boy, this guy has got some talent. So anyway, we're extremely grateful for him and for him pick the charity that he wanted, which was Camp Quality. And I think we hit about, I correct me if I'm wrong, but I think we may have hit up higher 300s, 400s, which is the most that we've ever raised in one night. So that's a new mark. So you new musicians sitting out there thinking, okay, yeah, take that as a challenge. But oh, we had a ton of people joining on, and I was warned that this guy is pretty popular, and I gotta admit I've never heard him before a person recommended him to me, and we invited him on, and he graciously accepted. And boy, oh boy, what an entertainment last night. It was one of those situations where I think what we're going to do, people were enjoying themselves so much. We're taking that 30-minute time limit, throwing it out the window because I could not last night. I could not in good faith say, okay, time to stop. People were just enjoying themselves. You could tell by the comments. They were donating money to the cause. Oh, what a good time. You get a chance, go on our Facebook page, play it. It's hitting the roof as far as views so far. I think it hit like, one of the thing about our show, our views are a slow burn, I call them. They start out really low, but then they jump up, and I don't know what the nature of that is. I don't want to know, but this one hit the ceiling shortly after the concert ended. It hit 1,000, and I think it's going beyond that. So, listen, you will be entertained. Without a doubt, this guy is coming back on, without a doubt. And we're going to ask him maybe to do one of our charities, and which he's graciously agreed to do. Oh my gosh, Eli, if you listen to the show, thank you, buddy. Thank you, thank you, thank you. You were a hero last night. So look at it. You will be entertained. Cover music all the way along. I think he played one or two originals, but Oh boy, did he kick it! He absolutely kicked it. Thank you, Eli. We're eternally grateful to you, and we hope to get you back on again. Um, Next up, and Char's sitting out there listening to us. Char, you guys kick it just as much, man. We can't wait to have you on Saturday. Can't wait. Oh my gosh. Actually, Eric, Char, and Eli ought to get together. Oh my gosh. Talking about a trio, that would be. Oh my god. Oh, a concert in my dreams. Oh my gosh. I'm just thinking of that. Oh, God, so maybe able to make that happen sometime. Maybe through a Zoom concert or something. I've heard that Zoom isn't good for concerts, but I'm going to try something here because those are three people I just mentioned are extremely talented: Eric, Shar, and Eli. Ooh, and I hope I'm not insulting anyone. Everyone that came on to a concert was awesome. But man, I tell you, Eli and Shar, boy, to have those two vocals together, woo! Oh man, I'm just getting shivers thinking about that one. Man, oh man. Yeah, so and we are very grateful for these musicians who came on. We've had any number of them. We've had Lou from Chris and Lou, a very famous band in the area. We were shocked that he said yes. So we had him on. The same thing with Eric and Char. They've helped us out before with a charity event for Habitat for Humanity. So that's Saturday night. The benefit that Saturday night is going to be for St. Jude House, which is a family violence prevention center and shelter. So, and again, all these, I can't tell you enough, all these charities, organizations have been hit hard. Literally, they've gotten their revenues taken away from them during this crisis. They are relying on a lot of us who still have monies to step up and donate. So please think of that this weekend. Sit back, pop some popcorn, do what you do, but you are going to be entertained. Here's a suggestion. Someone did this with Eli, with Eric and Char. Hook it up to your Bluetooth speaker. Share what you are going to hear, because it will be absolutely wonderful. You will be so entertained by Eric's playing on his guitar and by Char's amazing vocals. Oh my gosh, I just think about here, she can hit the low and high in between, and she will make you think you are in heaven. That's that girl can do right there. So, boy, I'm looking forward. Kelly and I are when they agreed to do this, we're like, woo woo, yeah. So, yeah. So, well, here's another thing, kind of a neat thing, a neat event popping up here in the region. Habitat for Humanity of Northwest Indiana is going. They had them on last night on their TV show that we've kind of provided for them, and they came up with kind of an exciting event that I'm excited about, and it's going to happen this weekend. And I'm going to show you the weather report just to give you hope for this weekend, because it's going to be an awesome weekend. It's going to be an amazing weekend. So, Habitat for Humanity is organizing a virtual run, a 3K run walk event. So, you can track your steps in a Fitbit. You can do it in your Track My Run or any of your tracking apps, and just post your results and along with the selfie on the site. If you will go to the Habitat for Humanity's Facebook page in Northwest Indiana, if you go to this video, you'll see a link to it, and just go there, register. I believe they have two levels of registration. One is $25 and one is $50. But I tell you, this is neat. I mean, it's just inspiring people to get out. Or if you don't feel comfortable going out, you could do this on your treadmill. Just please take a selfie of yourself doing it, and post your selfie with the times. This is going to be fun. It's going to be a great weekend. It's the submittals, for this. You can start at 5:30 in the morning on Saturday morning and go all the way till Sunday 10:30 in the evening. And as I told Wendy, it's going to take me that long to do a 3K. I'm so poor out of shape. It's, but it's going to be fun. You can get a family member, get out, walk the dog, and keep track of how long you go. And so just go up there. I believe one of those levels you get a T-shirt. The old school Habitat for Humanity T-shirt is one, and the other is a pin. But go up there, you'll get all the information. Fun, 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 fun. That's going to be fun, and it's going to get you walking out. And you please do that anyway, and be safe while you do it. But man, this weekend is tuning up to be an awesome weekend, folks. Get out there, enjoy. I can't speak what's going on in New Zealand. I haven't looked at their weather report, but I know ours. So I have to say that because Robin's out there, our fan from New Zealand. So yeah, Habitat for Humanity. And they're calling it Run for Home, virtual Run for Home, 3K walk and run. So, whatever your condition is, get out there. It's going to be a fun event. Plus, all your dollars will go to support an amazing organization that helps supply affordable housing for those who can't afford it themselves. And for those who are familiar with Habitat for Humanity, it's a partnership. People come to them and say, I really need to get up my family out of this apartment. We're paying thousands of dollars in rent, and it's not a good situation. They provide a zero interest loan mortgage and then they partner, and you participate in that build all the way through. You're out there on the site slinging hammers and deciding where things go. It's an amazing, amazing program. And one of our heroes, Jimmy Carter, is their mentor. Um, their person. I mean, he is the most popular member of the Habitat for Humanity. So please give that some consideration. That was a great show that we had. I had a lot of fun because I think it's quite honestly going to be a great event. I hope they do it again. So please participate in that if you can. Again, Habitat for Humanity, virtual Run for Home, and that is a walk as well. So, register. Hey, Robin, I think you could even register if you can. I don't know, but it's going to be a fun way of getting out there and enjoying the nice weather it's set our way. Another thing we're going to try to, I'm going to tell you, we're going to try to get on. These are another hero of ours, Lori Postma of the Northwest Indiana District 1 Emergency Operations Center. They are coordinating all the emergency efforts in the District 1 area of Indiana. And that services LaPorte, I think Jasper, and Lake and Porter County. So what they do is coordinate all the PPEs. They're taking donations on PPEs, gowns, and they're trying to get those to hospitals as quickly and as humanly as possible. Why I want to get them on, I see that they're also coordinating test sites. And I would like to get them on to talk about test sites, because I think if you look at the last night's show that I did with Michael Puente, boy, it's kind of scary, but you need to be informed. So we're going to try to get Lori back on. They don't know about this yet. I kind of reached out on the air the other day, but I'm going to try to call her up and ask if she would be gracious enough to do another show with us and get you informed about a couple of things going on with the COVID-19 response in Northwest Indiana specifically. Okay, head back to what I would like to highlight as being our theme for this morning's show. Our heroes wear scrubs. Well, I'd like to thank Northwest Indiana Times for allowing me to use this. I didn't seek their permission as usual. I just snapped it. But I'm saying now, this is a picture from Northwest Indiana Times. This is out in the Crown Point. I believe this is near what used to be called St. Anthony's. I forgot what that hospital's name is. But anyway, this is the theme of our show that I would like to hold up to you today. Our heroes wear scrubs. And that is definite. Boy, I tell you, and I'm not going to do it again because someone said, "Oh my gosh, that poor lady." I showed a nurse's a Facebook friend of mine after she got off duty and 12-hour shift and took off her protective gear, and oh my gosh, the scars on her face from wearing, because usually they're in and they wear these, they take them off, in a usual day. Now they have to keep them on for their full shift, so they're starting to develop sores in where these face masks are starting to have contact with their skin. Um, and I mean that's why I call them heroes. They know this. They have to wear it so that they stay healthy, so they can continue working. Again, a classification of a hero right there. Um, and here is what I'm going to post on our Facebook page and ask for you to submit a picture of a nurse, or yeah, right now it's going to be nurse. We'll get to physicians in a bit, maybe. But right now, I'd like for you to think about a nurse that you, maybe your neighbor, you know of. If you're a nurse yourself, give us a selfie, please, and post it on our Facebook page. We are going to celebrate nurses and their heroism in what they do day by day. And we just want to hold them up because they are today's hero. And so think about that. Look at our Facebook page, and if you know someone, have a picture of them, and would like to just call them out as a hero, please do that. And I've adjusted our Facebook pages so that you can post pictures and comments now. Facebook, yeah, I won't get into that. I'll spend a whole 3 hours talking about Facebook. Um, Interesting thing last night. We've had a really good relationship with Michael Puente, who's the WBEZ reporter for Northwest Indiana and the Chicago area. This is a award-winning reporter both in Indiana and in Illinois. Last year, his peers recognized him as the number one reporter in Indiana and Illinois for very, very good reason. He's a very good investigative reporter. He is also adjunct professor, I believe, for journalism. Very, very good. And Michael has one craft that I've always, always appreciated: the ability to tell a story in a very short, concise, and meaningful way. He could do a 15-second report that will make you feel like you were in the room. And that's the reason why he won those awards. He has a way of doing that that is phenomenal. Kelly, myself, has been good friends with Michael. Kelly longer than I have. I've just, like, within the last 4 years, I believe, have become a friend with Michael. But I've always, that's friends, but I've always appreciated his craft from afar, because I'm WBEZ is one of the only news program or radio shows I listen to. And I'll say that again: WBEZ is the only radio station that I listen to when I'm in the car. And sometimes when I'm sitting here, because they are informative, they have thoughtful news shows, and they hired Mike. Yes, they hired Mike. Yeah, they hired a superstar as far as I'm concerned. So Michael reached out to me and said, "Hey, Bill, can you help me out with this? I've got all this stuff I want to put together, and I need to get it out there." We've been doing Zoom, Facebook meetings before it was popular. Before it was Zoom, we did other things, but we identified that when we moved into the new facility at our studio, where I should say at Executive Suite Squared, I began seeing all the technology that's available to us. I said, you know what? I think this is going to be the new norm. And before the stay-at-home was issued, we started doing, we just let people stay at home or their office and say, you know what? We're just going to video conference with you and make it easier. And we have the technology to blend it into a Facebook live presentation. So let's do it. We did it. We did that with Michael yesterday, and he was definitely the driver. I was just the I was the passenger, maybe not a backseat driver, maybe, I don't know. I commented a few times, but Michael pretty much had taken command of delivering the information, reporting about Governor Holcomb's news conference yesterday, and the new startling, as they always are, minute by minute changing numbers on not only Indiana, but Northwest Indiana. Michael did a good job breaking down the Northwest Indiana numbers. And I got to say, last night I made a mistake. Because I was looking at Indiana numbers, we are now sitting at a little over 20% of the tested uh, patients are testing positive, which puts us above, that's Lake County, which puts us above the average of the state, which is 18%. If you look at Lake County, it is highly impacted. We are now second in the state with number of infected cases and deaths. So, and that's, because of our population. We have Hammond, we have East Chicago, we have some high population areas, Crown Point. But yeah, if you have chance, he reached out to me and he allowed us to stream it on the Bill and Kelly Show site. But this was Michael's show. I make no suggestions otherwise because we just were there as technical support while he did his magic and did his craft that he's so marvelous at. So listen to that, and he's asked us to help him out with that again, and he's been our co-host when Kelly's been absent before, so we owe him a huge debt of gratitude for doing that. So we're going to help him out whenever we can. So look for that. We're going to be doing it tonight, helping him out tonight, and as often as he needs us to help out. And we've got a good working relationship with Michael, and he has the Bill and Kelly Show mug. Yeah, he does. Yeah, he's got it at his studio at WBEZ at the Navy Pier in Chicago. Yeah. Folks probably at WBEZ walk by and said, "What's that?" I'd like to be a fly on the wall when Michael explains to him it's the Bill and Kelly Show mug. Yeah, it's like well, what's that all about? Boy, so that's it. I mean, that's all I really have for you today. Boy, let me scroll through. Good morning, Char. Hey, Robin. You're a sweetheart, Robin. Are there any beauticians that could volunteer a gift voucher for a nurse or free facial once the stay-at-home order finishes? There's a good idea. Yeah. You know what? Yeah, we're going to try to do something. Yeah, we are going to try to do something. I don't know. Right now, I would just like to hold them up and celebrate them. Let them know by any doubt that they're appreciated. And yeah, and one thing I do want. Oh, you know what? Thank you, Shark. Gosh, you're amazing. Robin. Yeah, I forgot to do something here. Let me see here. Schedule and yes. Thank you. Thank you, Robin. It takes someone from New Zealand to remind me I promised you guys to look at the weather. Yeah, today it's going to be increasing cloudy, and we're going to get some more snow mix this evening. That's going to last all the way to Friday morning. Friday through Friday night. And then there's going to be a clearing. Friday night we'll have some patchy fog, and going into Saturday, right now they're calling for a high of 52. I'm saying it's going to get into the 60s, but it's definitely going to be sunny. Once we get beyond all this nonsense that's going to happen tonight and into Friday, there will be a clearing. We'll have a sunny day on Saturday and Sunday, and so it's going to be a great weekend, a great time to get out and walk and participate in that Habitat for Humanity walk, run, 3K. It's just 3K. It's not bad. So yeah, Robin, it's about 2.17 miles. So that's not bad. So really get out and walk, and get up and register. That and all the proceeds go for the Habitat for Humanity. If you're at the $50 level, I believe you get a T-shirt, and at the $25 level, they give you a pin. Which $50 for a run nowadays is nothing. I mean, I go up and I remember back in the day when I used to run quite a bit. It was like $10, $15, but now they're like $50, $100 for small fun runs, and yeah, so it's well worth it. Goes to an amazing cause, and if you get a T-shirt, that you're going to be able to wear that proudly. Yeah. So please do that if you can. It's going to be kind of an open schedule for us today and tomorrow. Kelly and I are moving to Chesterton, and so we're going to be doing that. We may come on today Tomorrow we'll be just doing the morning show, and then Saturday I'll be doing the morning show, and then we'll have the awesomeness of Eric and Char Saturday evening, and that's going to be great. Please, yeah, I know people are sharing it all over the place, but Saturday seems to be our premium time when we get a lot of views. So Saturday night is definitely a time that, but a lot of other things are going on. So I get why people can't. A lot of the musicians are doing their own Facebook Live um, on their own personal Facebook page or their business page. So yeah, we totally get that. But anyway, Robin says she walks 3.5 to 4.2 kilometers daily. That's great, especially now. I can't urge you enough. I don't do it enough. I've been exercising in the basement. Um, I used to, I used to do CrossFit, and used to, like not too long, about 4 or 5 years ago, I did pretty intense workouts. This is when I was a little bit better shape, had a 32-inch waist, and can probably run a mile. I run a 5K at about an 8-minute pace. Man, I'm far from that now. Jeez, oh, Pete, what's happened? Oh, man, it's that 30 pounds I put on has happened. Now it's like dragging a cement mixer behind me. That's what it's like to run for me nowadays. But, hey, I'm 60 now. Yeah. Yeah, I'm 60 years old. I don't want to use that as an excuse. Never. Yeah. But yeah, one thing I want to encourage you, and if you do it safely, try to stay healthy. Watch your diet. It's so easy to go off the rails on, when you're staying at home. And you're doing the right thing by staying at home. Because it's especially Lake County, high populated. Hey, good morning, Rhonda. How you doing? Try to get some type of physical exercise because I know it will improve your just your attitude. Every time I exercise, I love it because the endorphins release and you feel good. And not only that, you're positioning yourself to be in a better place to fight anything that comes your way, like a virus or a cold, and that's something you want to do because even if you don't get the virus, one thing that's been proven, if you do come down with the cold or the common flu, and you do come in contact with this virus, it could be devastating. That's what they've seen. If you have a pre-existing condition or something, that's when this virus really takes hold, and it has the equivalent of meat hooks. Literally, is what they call it. It latches onto proteins in your cells, and literally just holds on and tears in and causes your body to fight itself. And that's where bad things happen. So I encourage you to get out, play it safe, get some exercise, feel good, and just eat healthy. And then when you go to the store, be cautious, wear a mask. I can't say that enough. Anytime you go out of the house, wear a mask. Someone on our Facebook page said that they don't have access to masks. There are any number of people that are making these now, and you could go to the CDC and they show you how to make a mask out of plain material, 2 rubber bands and a handkerchief or a T-shirt, and you've got a mask, and you got to wear something though for your protection, and it's proven that just a plain old handkerchief or a T-shirt can be 70% effective. And I did a show on that, showing different types of material and projectile when people cough or sneeze. So yeah, please, please, please. And that's one thing I've got to say. For as affected as Lake County in Indiana has been, our observation is people are not being cautious. Yeah, and yeah, and now the population is true, but we're at 22% of tested are being shown to be positive, which is above our average, and so which is more cause for us to be more cautious in Lake County specifically. So hopefully, my goal is to get District 1 Emergency Operations Center on again to have them talk about the test sites in the area and their need for materials and let you know what's going on and what they do. And again, they're the kind of the offshoot of the Homeland Security for the District 1 of Indiana. And so their purpose, any emergency plan and so on, they coordinate it. Um, so that's it. Kaya Kala. Oh boy. Robin, we're going to have you on again because I don't know if I can even pronounce that. It's a Maori phrase used in people of New Zealand as an affirmation, meaning stay strong. Amen for that, And actually, thanks for bringing up, Robin, because that's something I've witnessed a lot. Businesses are putting up, what city or town they're in, like Highland Strong or Chesterton Strong, and encouraging people to stay strong. And the only way we're going to get over this is together and staying strong and helping each other out and reaching out. And I can't say that enough. Whatever we, no, try again. Kaya Kara? Nah. I'll. Robin put it up there. As people know, I'm the worst. I mispronounce my own name. So, yeah. So, at any rate, what I'm trying to get at is, I'm not sure what this is going to look like. The new norm is what everyone refers to it, and I know this is. I would be extremely shocked if we got back to a point of us being in the same economic condition that we were before. Um, and this is what I witnessed in the debate is now in the last couple of days. The debate now is not necessarily how we attack this and when. The debate is whether we sustain economically or save lives. Now, the issue behind that, and I am, that sounds cruel and hard. But the issue is the two sides of the camp are. Do we take time to save lives, or do we assure a quality of life when this is all over? And I contend this, and this is where I always lie back on. Um, what is the quality of life? Are we all accustomed to being able to go out and have entertainment, go out to a restaurant when we want, go out and get carry out food when we want, go out and see a movie. I think it's going to be different. I think for a while, most of the medical professionals are saying June. We can't, I want to encourage her when I said this on Michael's show last night. The World Health Organization has recently posted, and I think they came under attack for this, but they recently posted 6 critical points that we must meet before we can open up the stay-at-home policies. And one of them is to assure that we have this virus under control. No one at this point in time without a vaccine can assure that we have this virus under control. So first point right off the bat, we have not met yet. Then being able to progressively test and be able to assure safe work conditions. Otherwise, are all the companies where these people are going to go back to, are they going to have protective gear for people to wear to assure that other people are not affecting each other? Because if that doesn't happen, we could be right back in maybe in worse shape before. So these are all recommendations, 6 points. If you want to see them, go up to the World Health Organization, and you'll see 6 recommended strategies for opening up our society again. And they are all logical. So, yeah, I want you to give that cause and, just continue praying and helping each other. And we're all going to get through this together. And it's going to take teamwork. It's going to take us dropping our, our angst towards each other and getting and working together and trying to understand the other person's viewpoint and not trying to use politics. I think we are going to look at a shifting of the political environment, and it's going to have to be out of necessity. We can no longer use or launch political agendas in this nature. We have too much at stake right now. We have people's lives, livelihoods, and so we have to all sit down, work together, and regardless of we're Republican or Democrat in the past, we have to put that aside and look at the logical things that are going to get us beyond this. And I've said this in 60 years, I've never seen anything like this. 9/11 caused us to sit back on our heels, caused us to work together more effectively, both Democrat, Republican, and this is much more extensive. I mean, we've gone beyond the death impact that we had in 9/11, and the impact that of the injured. If you look at the infected, so we're beyond that. We are beyond a lot. Now we're going to be looking at the world wars. How many people did we lose during the World War, and how many people do we lose in the Civil War, which was the most devastating historically to this date. The death toll in the Civil War by far was higher than any of the world wars. So what impact are we going to be looking at? It's going to be new, and so I urge all of you to think logically, look at things from a logical standpoint, help each other. When you go out, please play it safe. And when I say play it safe, I mean play it safe not only for you, but the person that you are going to become in contact with. Face mask. Again, you have a T-shirt, you've got some type of cloth towel, 2 rubber bands, and a towel will make you a face mask to go out. It's not going to be a designer one, but I mean, and people are selling them. You'll find them anywhere. A lot of people are making them. And the higher grade ones definitely are going to the hospitals. Those, please, in fact, if someone attempts to sell you one of those, tell them, please contact the District 1 if they're in Northwest Indiana Emergency Operations Center and donate those to them so they can get it to a hospital, to nurses and physicians and caregivers that need them, because that's where they belong. But the others, the cloth masks that people are making, they're putting filters in them to make them more effective. You could find those, and we found them, and but you don't have access to them as an excuse, because you can go on the CDC's site and they show you how to make 2 different types, some from just rolling up a piece of cloth, and some that they give you a template for cutting it out and use some elastic bands to make an effective face mask. But that's one thing, I guess, that's disturbing. As Kelly and I go out, we're one of the few that are wearing them out in public places, and we wish we can get gloves. I'm going to dig up my gloves that I have that I've used from a beard dye. Yeah, I wear beard dye. So there, give me a minute. So if you got gloves like that, something that you can wear out in public, because that is one thing. Kelly still has some little hand sanitizers that she's had from those little travel kits that she has that she's using, and we're using sparingly. So anytime we come out of a store, we do hand sanitize, and we don't take our masks off till we feel like we're fully disengaged from other people. And that is the new norm for a while. I'm sorry to say, you got to. If you got rubber bands at home or a T-shirt, use them. Don't go out in public without a face mask, please. In fact, in New York, I just saw that they are now mandatory. And I was reading an article where now in Japan and in China, the same thing. If you're caught without a face mask and you go out, you're criticized. I mean, it is a culture now there. You just don't do it. And I think that is going to be a culture with us pretty soon when we look at death toll in Indiana going 365 and climbing above our death rate. I believe is at 25 people per day and increasing. So, I mean, it's starting to level off, and that's where we see hope. But still, when we have that type of numbers, face mask, please. And make sure you're safe, because this thing, you can be a carrier and not know it. So if you're saying, oh, I feel fine. No, wear a face mask. because you don't know if you're a carrier, you don't know if you're going to come in contact with the carrier, and and this is something that's very disturbing. If you don't feel good, if you've got a cough or sneeze, stay at home. Contact a neighbor and say, "Listen, I need," or use Instacart. That you got Instacart, you've got those home delivery options available to you, and yeah, yeah. So please use that. Don't go out if you're not feeling well because you're going to endanger others, and even when you have a face mask, because just the plain cloth. And I did an entire show. I graphs, they're not totally effective if you got a cough or a sneeze. But normal situations, it is protective, 75%. But if you're going to sneeze or cough, as in you are sick and should be staying at home, that's where the face mask renders itself almost useless. And that's why we were told, it angers me, why we were told that they're ineffective. Because they saw that and they said, well, that's no help, so we're going to tell people they don't have to wear them. Well, now, I've just looked at, and I could do this again if you guys would like me to. I can show you through the research they've done on face masks how they are 75% effective unless you're sick and are coughing and sneezing. Then they aren't. So there you have it. Okay, I'm rambling here. So yeah, as Robin says, a sock, anything, any cloth over your face is going to protect others and protect you. And if you're sick, you shouldn't be out anyway. So there's my lecture. They're going to come down off my soapbox. So there you have it. That's the show for today. And again, I'm going to be posting a item on our Facebook page to share your nurse heroes. It's going to be nurses right now and physicians later and first responders, but we're going to start off with nurses because they've always been underappreciated what they do. They've always been, and a lot of doctors will say, nurses have saved them. Nurses have caught them doing something maybe that they didn't catch, and they'll say, doctor, do you really want me to do this? And so they're heroes for so many reasons. They are not, they put in the hard hours, and they are the first line contact with the patients. They come in physical contact on a daily basis with the patients, and this we already know through research. Those people, when they're exposed to 100%, and some of them they are in the midst of every patient, bed to bed, is a COVID-19 patient. When you're subjected to that much, the impact it's going to have on you is going to be even greater. So when you're exposed to that, even your protective gear sometimes falters. So there you have it. That's why we need to make sure that they have fresh masks that they can change out as often as need be. But that's the problem. There's still not enough face masks for these people. And that really is disturbing. And it's not the cloth ones that we're being taught how to make. It is the highly effective ones that are surgical masks and on up, B95s or whatever they're called. Keep that in mind. Just be safe, and let's be conscious of each other and when we interact with each other. And with that, I'm going to tune things down. Just some reminders. Habitat for Humanity. The virtual run for home is what they're calling it. If you can register and do it, it's going to be a great Saturday and Sunday, so you can't use weather as an excuse. You can do it inside on a treadmill if you're saying, I don't want to take the chance. You could do it on a treadmill, or do what Mary Varvan, our 93-year-old friend, does, is step in front of the TV, because she has a Fitbit, so if she doesn't make her step budget by the end of the day, she steps in place in front of the TV. Do something, and do something to participate. It's going to make you feel better. And if you want to register for it, great. Even so much better. Go to the Habitat for Humanity, Northwest Indiana, and they'll have a link there that you can click on to register. And so please do that. And Eric and Char this weekend. Boy, yeah, that's going to be entertaining. So please look for them on Saturday. And we're going to do a short interview with them before we get them to stream live on our Facebook page. So that's going to be fun. That is going to be absolutely fun. Boy, I tell you, it's something that we do appreciate, and it's something that I knew that we had to do to provide something to take people's mind off it. The other thing I want you to think about, we have a show every Wednesday at noon called Connections Restored. Um, Amy Boswinkle does an amazing job in talking about your mental duress and what that can do to you physically. And so, please, if you're going through some anxiety issues that you need help with and just need some methodology to get out of there, she's very, very helpful. She's going to be doing this every Wednesday for at least another month. So tune into that, and her shows you can get to on our Facebook page. Again, that's called Connections Restored. Then our concert series. Yeah, I'm already lining up people for next week, so please tune in for that. Um, Boy, that's it. So with that, I will let you all go and say good day for now, and please stay safe, and please make your submittals for your hero nurse, whether that may be. Yeah, make sure it's okay with them first. Put their picture up, and they don't want their picture to be on Facebook. If it's okay, then post their picture. If it's you, and talk about what you're going through. If you're a nurse, you just post your picture because we want to celebrate you and what you do, and what you do for us right now, and you're our hero. So with that, I will say goodbye and tell you have a great day. We're going to go through some bumpy weather tonight and tomorrow morning. Then it should smooth out for Saturday and be an awesome day Saturday. So with that, I will say goodbye for now. Remain safe. Kelly and I love all of you dearly. So please stay safe for us, and we love you. Goodbye for now.